Chris Geller here again, back with Pinnacle Training Consulting Systems. Now we're on the section on core, and particularly core anatomy and the foundation of the core. So I've talked earlier, beginning of the first couple videos, I talked about some more musculature, but I want to get now into the core muscles again of the spine, stabilizers, and about the research about them and how they play a role in when you're looking at clients, what they mean to you. So again, we have four primary muscles of the lumbopelvic region. Of the 29, but the four that I'm concerned with were the obliques, which are on the side, the transverse abdominis, which goes along diagonal, your QL goes to the 12th rib, top of your hip, and then multifidus. So again, the obliques, again, come along the angle, they provide support laterally. Their job is rotation and side bending. The transverse abdominis, which again is a muscle that's been shown by Paul Hodges in the research in my manual. You'll see in our manual has been shown when someone has a low back injury, basically that muscle almost shuts off like a valve. And so as a therapist, my goal is to teach my patients how to turn it back on. When working with you in fitness and training clients, you want to make sure they're engaging that transverse all the time. Go back to the back side, QL, 12th rib crest, typically is tighter and weaker. So we talked about how to assess it. I'm going to show you ways of strengthening it. But if it's tighter on the inside, it tends to cause pain in the glute region, refer pain, and that's back to Chevelle and Simmons, who were physical therapist and a physician back in the 50s. And it's tighter on the outside, that's going to cause pain and lateral pain or glute, referring to the glute region. Okay? And then finally, multifidus. Multifidus goes again from the sacrum all along the next to the spinous process, up to the sacrum. I'm sorry, up to the cranium. So, the thing I want to remember this, key thing is, QL, you want to stretch the QL. And one of the ways you can stretch the QL that I like is in a kneeling position, hands, say the right QL is tight, hands all the way to the left, and leaning back diagonally to the side. Okay? So if the left side was stiff, hands all the way to the right, lean back to the left. That'd be how to stretch the QL. It also is in our manual, but again, you can do it also sideline, but I find it really effective. I've shown you how to contract multifidus. Again, getting them to do an anterior pelvic tilt, slight contracting, and then extending the hips up. I think you know about transverse abdominis, which is doing the posterior pelvic tilt, tightening. So here, when trying to get their transverse contracted is ASAS, draw that contracts the transverse, knee 90 degrees, and I'm maintaining that tilt the whole time. And then when I'm done, I'm again letting go. And the obliques, anything is going to be into the side region or rotational. Rotational being across the opposite leg or across the opposite knee. Again, doing sideways, or even doing one leg at a time. Okay? So the research, remember, I want you to remember, transverse abdominis is weaker in chronic low back patients, particularly acute low back patients. And again, per Paul Hodges, the multifidus, which is the muscle on the lower back, is a chronic low back pain problem per the research. And with my patients who have chronic low pain, I found that they have a real difficulty to contract multifidus properly. Hope that makes sense. You've got some tools now to assess, to train, and we'll talk in a few minutes about the next section about how to stabilize and move the progression of stabilization training.